Hello, my name is Michael Stogner. I am one of 7 candidates for the Sequoia Healthcare District. And I just wanted to give you a little background of who I am. I've been identified in a national legal magazine as a local government watchdog. I've also been described as a victim's advocate in San Mateo County for several years. Most recently, I ran for supervisor of San Mateo County. I was one of 5 candidates. One of my opponents was a man by the name of Jack Hickey, who I'm now pleased to say that I'm teaming up with Mr. Hickey. He contacted me and invited me to run with him and one other gentleman, Fred Graham, as a slate for the Sequoia Healthcare District. I just want to go into a little history of the Sequoia Healthcare District. It was formed in 1946 by the Board of Supervisors of San Mateo County. It did a great job. The purpose of it was to work with Sequoia Hospital. In 1996, Sequoia Hospital was sold. In 2000, a grand jury made a recommendation that this organization stop receiving public funds from taxpayers. In 2001 and 2002, a second grand jury made the same recommendation. So functioning from a victim's advocate point of view, I think the victim in this particular scenario is the taxpayers of San Mateo County. And what Mr. Hickey has been trying to do for several years is enforce or implement what 2 separate grand juries recommended. If the citizens or the voters of San Mateo County vote for Hickey, Graham, Stogner, the 3 of us have promised to implement the 2 separate grand juries' recommendations, which is stop receiving taxpayer money and stop having what we call pet projects and false philanthropy. So again, what's needed here is 3 separate votes. There are 7 people to choose from. If Hickey, Graham, and Stogner are not elected, then the recommendations of the grand juries most likely will not be implemented. So the best thing I can do is ask each one of you as voters, and it's mostly just the Southern District of San Mateo County. So people, there are 72,180 reasons to vote for Hickey, Graham, Stogner. Those are the parcels that pay the $7 million of taxes to this organization. There are 7 million reasons to vote for Hickey, Graham, Stogner, and that's the amount of money that was received last year from those parcel owners. And just know that if the public does vote for this 3 people, Hickey, Graham, Stogner, we will finally put an orderly shutdown of this organization that is no longer functioning under its original purpose. Thank you very much.
Hi, I'm Arthur Farrell, running for the Sequoia Healthcare District Board. I've been a San Mateo County resident for the last 46 years. I currently live in Redwood Shores and have lived in Redwood City and San Carlos for the past 46 years. I've got a bachelor's degree from the University of Vermont in economics and a master's business administration with a specialty in healthcare from the George Washington University. I'm married, have 3 children, 5 grandchildren. It's a little bit about my background. My career has been in healthcare. I've been working at Sequoia Hospital, or had been working at Sequoia Hospital since graduate school, and ultimately became the CEO of the hospital and retired from that after we merged with Catholic Healthcare West. And the reason for the merger was Sequoia Hospital was a standalone facility in a very difficult healthcare economic time. We needed to affiliate with a larger group in order to be able to survive. The hospital wasn't doing very well at the time, and we knew that we would probably not be able to stay in business unless we affiliated with a larger system, which we did. I helped lead that move from a district hospital standalone to a member of Catholic Healthcare West, a $4 billion three-state operation, and Sequoia Hospital now continues to thrive. It's doing well and, in fact, building a new facility. I've been on the Sequoia Healthcare District Board for the last 12 years, and currently I'm seeking re-election. We do a lot of good for the community. This district puts millions of dollars into the community for health care. My personal goal is to see that people stay healthy and out of the hospital, but we also do work and contribute money to Sequoia Hospital so that it can do well. Currently, we're sponsoring and helping fund the Women's Health Care Clinic, which emphasizes breast treatment. We also give money to Samaritan House, which takes care of people who don't have insurance. We give money to the county for some of their clinics. We fund registered nurse education through San Francisco State University as well as Kenyatta College to ensure that we have nurses in the future for the hospital. There are those who think the district should be disbanded, and my opponents are running to do just that, saying that the taxpayers will save some money. It's not true. The taxpayers will not save money if the district were disbanded. That tax money would continue to be taxed, and that money would go to the state or the county and not necessarily used for health care. The average household only pays about $30 or $40 a year in taxes to the district as it is, so it's a rather minimal thing. The grand jury in 2004 and 2008 supported what we're doing. They indicated that what we're doing is not only legal but beneficial to the district. So we want to continue doing that. My goal is to stay on the board so that I can continue to help fund healthcare programs for the community, for the betterment of the community. And I've been happy to do that. I've worked in numerous volunteer activities in southern San Mateo County. I've been chairman of the board of the American Heart Association for the county, as well as for California, Nevada, and Utah. I've also served in other volunteer capacities, including chambers of commerce of both San Carlos and Redwood City. I've been endorsed by a number of community leaders, including Don Horsley, Danny Gasparini, other elected officials, as well as the Central Labor Council. I ask for your vote. I think I can continue to do a good job for the community. I think we need Sequoia Hospital District in our community. It's a very, very important asset for both you as well as the rest of the people in the community. I ask for your support. I hope you vote for me in November. I thank you for your time.
Hello, I'm Jerry Sheffrin, and I'm a candidate for the Sequoia Healthcare District Board election this year. I have lived in this community for over 35 years, and I have spent my entire career in the healthcare environment. I am a practicing physician, and I have extensive experience as a healthcare executive in our community, serving in leadership positions at 3 area hospitals, a major not-for-profit health plan, as well as managing a very large outpatient clinical service. I have also served on the Grants Committee of the Sequoia Healthcare District Board in the late 1990s, as well as the year 2010. And I was a member of the Healthcare District Board from 1998 to 2002. I'm running again for this position because I believe in the mission of the district and feel that my background and experience will allow me to be an effective board member and promote the efficient use of our tax dollars. The mission of the district is to promote the health of our community and its members. Originally, the mission envisioned that this could best be accomplished by building and operating a hospital. In the 64 years since the formation of the district, the delivery of health care has changed dramatically, and the district has changed under the law to move away from running a hospital towards other health objectives. This is common in California, where approximately 1/3 of all healthcare districts no longer own or operate hospitals. I think there are 3 main healthcare objectives that the district should focus on. They are access to care, preventative care, and healthcare education. I believe we need to improve the access to care, whether it be hospitals, outpatient facilities, physician offices, or other provider clinics, especially for those living at or below the poverty level. In spite of the excellent care available to many in the district, there are also many community members who do not have access to that care. Those objectives also include an emphasis on preventative care, which can include traditional examination and tests for disease, as well as identifying specific issues for a population that can lead to health risks. Examples of this include structural problems that can lead to falls in the homes of our elderly citizens. Mental illness, which aside from being a problem on its own, is also a cause of other serious medical problems, and issues concerning spousal abuse. If preventative measures are not employed, the community will inevitably pay much more for the care in other ways. Another area of concern is the education of district members on important healthcare issues such as diet, exercise, food preparation, obesity, pregnancy, and STD prevention. This is especially important for our children and those with language barriers that make it more difficult to access traditional services. The unmet needs for many of these services in our community remain significant and has not been helped by the current economic climate. The district currently receives $7.2 million each year from a population base of 400,000. That comes to an average of only $18 per district member. The specific role of the district board is to identify the most important areas on which to focus these resources, identify the programs that are most likely to have a real impact on those areas, and then follow up to make sure that the resources were used appropriately and effectively. This year's election for the healthcare district is especially important for the voters because of the 7 candidates running for the 3 seats. 4 candidates, including myself, Art Farrell, Alpio Barbera, and Ruth West Gorin, support the district and the work being done with your tax dollars. The remaining 3 candidates have clearly expressed a desire to shut the healthcare district down. It's important to remember that the Sequoia Healthcare District has always been about the desire to live in a healthy community and understanding that community involvement is the only way that can occur. When the district was formed in 1946, that meant building a hospital. But the specific interventions needed to have a healthy community have changed, and the district's mission and function have changed with it. I hope I can have your support to continue this important work. Thank you.
I'm Jack Hickey, elected member of the Sequoia Healthcare District Board of Directors since 2002. During my tenure, my referendum petitioning effort was instrumental in keeping Sequoia Hospital at the present location. Now that Sequoia Hospital is being remodeled under complete control and ownership of CHW, we must decide what is to become of the district. The Sequoia Healthcare District election has historic significance. At stake is whether this voter-created government agency, which lost its charter when it sold the hospital, can be shut down. 3 seats of the 5-member board are up for election. A clear choice exists for voters. Vote for Jack Hickey, Fred Graham, and Michael Stogner for an orderly shutdown of the district, or vote for any 3 of the 4 other candidates to continue property tax collection in support of the presumptuous philanthropic activity engaged in by the current board majority. A brief history is in order. In 1946, voters established a Sequoia Hospital District in southern San Mateo County to maintain a tax-supported hospital, understanding there would be future bond issues to build and add to the hospital. In 1947, county supervisors assessed district taxpayers for this purpose. The hospital opened in 1950, and its operation was funded by property taxes until 1996. Art Farrell was CEO of Sequoia Hospital when they ran up a $29 million deficit. The Sequoia Hospital District Board sought and found a white knight to bail them out of their financial crisis. In 1996, the board presented Measure H to voters of the district. Measure H would sell some assets of the district, including the hospital, to Catholic Healthcare West, a private nonprofit organization. I am mindful of the praise afforded CHW by Britschke and Uccelli et al., proponents of Measure H. They said CHW provides free health care for poor and uninsured patients, contributing $129 million in uncompensated community benefits last year. In 1995, CHW gave $57 million in grants and gifts to the communities where the facilities are located. CHW reinvests all profits from its hospitals back to the community, not to corporate investors. Voters approved the sale, and maintenance and operation of the hospital became the responsibility of CHW. Today, tax revenues and other district revenues are being spent by the Sequoia Healthcare District Board in great part for charitable activities within the district, but not in significant part to the purposes described in Measure H, or the 1946 ballot measure. The 2001-2002 grand jury found that district taxpayers should be made aware that the 1946 measure authorizing the tax assessment was for the construction, maintenance, and operation of a hospital, but that the district no longer owns, maintains, or operates a hospital. The grand jury also found that since the sale of the hospital, the district has assumed a role similar to that of a philanthropic foundation, using its tax revenues to make grants to other government and nonprofit agencies. This is a function of the district that was never presented to the voters for their approval under 1996 Measure H. Hickey, Graham, and Stogner call for annual reductions in property tax collection, an end to presumptuous philanthropy, elimination of public relations branding activity, which is $50,000 a year, elimination of board members' health insurance, $75,000 a year, cancellation of association memberships, $35,000 a year, more appropriate funding of the nurse program by the Nurses Union and Hospital Consortium, $1 million a year, transferring the HeartSafe program to a nonprofit agency funded by manufacturers of defibrillators, the insurance industry, and charitable contributions, an end to the backdoor bailout of school districts, $1.5 million a year, an end to the $1 million grants to the Sequoia Hospital Foundation, and an end to the $1.35 million grants to the subsidies for health insurance for families with incomes 4 times the poverty level. An orderly shutdown of the district. On November 2nd, vote for Jack Hickey, Fred Graham, and Michael Stogner. Thank you.
Hello, my name is Alpio Barbara, and I am running for a seat on the Sequoia Healthcare District Board in this November's election. I did not make the choice to run for the Sequoia Healthcare District Board without taking time to study what the district has accomplished and its potential for even greater success in the future. I believe in the healthcare district and the great work it does to help bring a bright future for so many who are in need. I want to ensure that the district is kept as a community asset and disagree with those candidates who believe the district should be abolished. As you may know, the Sequoia Healthcare District partners with the public and nonprofit community providers to improve the health of children, youth, adults, and older adults in ways that are both innovative and traditional. These groups include Meals on Wheels, Second Harvest Food Banks, the Shelter Network, all public schools within our district boundaries, the Children's Health Council, Leslie Senior Communities, Peninsula Volunteers, Boys and Girls Club at the Peninsula, and the Veterans Memorial Senior Center. The community needs these groups and the many others we partner with because they are so outstanding and vital to us all. Current economic conditions have taught us that every public dollar must be used wisely for projects with measurable goals that include the accountability to the health board and community involved. You can trust me to use my knowledge and experience to ensure that your district taxpayer funds get the highest return for the highest community benefits. On a personal note, I have experienced the life-saving work of Sequoia Hospital, as the outstanding medical staff have given me the finest medical care I have asked for on at least 3 occasions. I will continue to help support Sequoia Hospital if I am elected. As I seek election to the board, I need your ideas, encouragement, and your vote so that I may take this all-important next step in my dedication to our community. I encourage you to please contact me at 650-245-4653 or visit my website at www.alpiobarbara.com so that together we can continue to chart a positive course for the Sequoia Healthcare District and our future good health. I respectfully ask for your vote on Tuesday, November 2nd, or by absentee ballot. The best health wishes to you. Thank you very much.